Good afternoon. I'd like to welcome everyone to the May 14th Curriculum Committee meeting of the Radnor Township School District. First item on the agenda first item is administrative remarks and introductions.
Thank you. Just quickly about our agenda tonight. So tonight, we're going to be looking at some board action items. We have some folks here with us to talk about the PAYS data, and we're also going to be looking at the wellness study. What we're going to be doing tonight, time-wise, is we're going to plan to get as far as we can by about 5:50, and then we'll stop wherever we are, and we will move into whatever we need to into next month. On next month's agenda, we already have the report on our English language learner audit and the report on our K-12 library audit. So those are the two agenda items we'll be squeezing that in with. So we'll see how we do tonight, and then we can make an assessment as to what we need to do for next month. Thank you.
Okay, sounds like a good plan. That brings us to public comment. Is there any public comment at this time?
Roberta Winters, 326 Williams Road in Rosemont. I just wanted to commend the board for releasing the PAYS information to the public. I think it's important, particularly in light of the recent change in our school start time for the high school, and we would hope that those changes might, in fact, diminish the risk-taking behavior that we see that many of our students are engaged in. Thank you.
Thank you. Is there any other public comment? Seeing none, we will move into our agenda. First action item, the approval of the minutes. Committee. Okay, the minutes are fine as written. And that brings us to the agenda items for the board business meeting.
So I'm going to just highlight a couple of these. You had them all in your packet to review, but just a couple of things. So the overnight student trips are both ratifications, so they were trips that happened in the past that had administrative approval, and they're coming to you after they occurred. Sometimes when students qualify for competitions and things like that, like our Sea Perch team did, we don't have time to bring them to the board for approval before, so these are coming through for ratification. I wanted to talk a little bit about the contracts. You have the Schoology contract coming through. So that's our Schoology contract for next year. That'll cover our services for K to 12. And then we also have a contract for a trainer at the middle school. So this is an athletic trainer. It's something we've been working on, since last spring. In the past, what we have done at the middle school is we have contracted with a lot of different companies and kind of piecemealed the trainer together. We never really know who the trainer is going to be or who's going to show up. In fact, sometimes the coaches will even tell us that the game will end and they aren't even quite sure who on the bench is the trainer. And then sometimes the companies can't cover the job, and then we don't get a trainer at all. So we've been investigating the possibility of doing something at the middle school similar to what we do at the high school, which is contract with a full-time trainer. At the high school, we use Rothman. Kevin is our trainer at the high school. He's been there for several years. He follows our athletes through their programs. He's familiar with their injuries. He's familiar with the schedules. He's helped us with things like the coach's guide, emergency evacuation plans, things like that. So there's a lot of benefit to have someone who's connected with the district. The minimum number of hours we can contract with a trainer in order to get someone to commit to work with Radnor exclusively is 32 hours. So this is the smallest contract we can get. The other challenge at the middle school is the games and practices tend to be canceled more often than they are at the high school because of weather and things like that. So what would happen is this person would be designated for the middle school, but if there were times when a game was canceled or the weather happened or whatnot, then that person would be working in tandem with the high school folks, and the two of them would work together to get the best possible coverage we could have for both of our schools. We have several locations other than just our two campuses where students students play sports. So there's also the challenge of covering all those other places as well. So they would work together. So this is in the budget. This is in the preliminary budget that you've been looking at. You can see the fee on the contract itself. There's also, with having a trainer, this is considered full-time, we're also looking to an increase in supplies for the trainer by about $2,000. So better services, we need more ice, more wraps, more salt, things like that. So I just wanted to give you a little background on that because that is something new this year. But we're really looking forward to having that in place and all the things that they can do to help us, even with pieces of the wellness study. Does anybody have any questions about anything else on the list?
Go ahead, Sarah.
Yeah.
I have a couple questions about the trainer, and I know we're tight on schedule, we have a lot of important stuff to get to, but, so it's 10 months, even though we only have blocks of a few weeks at a time at the middle school. We don't have sports every week of the school year at the middle school. So when you say this is the minimum contract we could get, that's it, like they're on retainer?
Considered 10 months, but the hours can ebb and flow. So he might work
That was my
40
question.
hours one week. The other thing is they're also trained to help with things like training for stop the bleed, concussion baseline testing, like there's first aid training. There are a lot of other things that we can do with this person.
Okay.
And we can always have something for them to do at the high school. Because sometimes our trainers have to run between fields if there's an injury or something like that. They'll have to either jump in the car or jump on the golf cart and get to another location. So it'll give us some better coverage.
Okay, but this is primarily a resource for the middle school, so
Exactly.
it's something that, and it's not specific hours during the week, so our new principal can come in and make decisions about the
Yes.
best place to use this person if we need
And in
some
the
other kind of
past,
assistance.
at the middle school, we only had the trainer for games. We didn't have them for practices. So this is going to give us coverage for practices as well.
Okay, and there'll be someone making sure that it's fairly allocated among the sports?
Yes, the two athletic directors will be working together with the two trainers.
Okay.
All right?
No, I think that's great, thank you.
It's very exciting. Thank you.
Can you just refresh my memory? I'm not sure I ever knew. What do we pay for the high school trainer?
For 45, I want to say, 44, something like that, in the 40s. It's in the low 40s. And I think the materials cost is a little higher, like $5,000 or $6,000. I looked at those numbers about a year ago when we started this. But Kevin's been there for quite a while, and it's been really successful relationship.
Okay. All right, Andrew, anything?
So I
Okay.
also had a question on Schoology, if you were, and I know we've talked about this before. So we're
Yes.
paying our Schoology license based on the students in the
Yes.
enrolled in the district.
Yes,
So including all the elementary school students.
yes.
Even when their teachers aren't using the system.
Right, so what a lot of vendors do with software is it's based on basically your school size. It's not even based on, it's like you're a
Right.
medium school, you're a small school, you're a large school.
Right.
So yes, regardless of the usage, we pay for it based on our enrollment. We do also have, I know we talked earlier this year about our Tier 1 technology expectations for teachers. We have an in-service day coming up on June 17th or 18th.
June 18th.
The one in June, and we have earmarked that to make sure that we have closed the loop on all our Tier 1 pieces and begin to introduce our Tier 2 pieces. So Schoology is going to be sending in 3 trainers that are going to be working across the elementary and the middle school. We also had a group of teachers attend a Schoology training at the Lancaster Lebanon IU about a month ago, and particularly the elementary teachers were very excited about all the things they realized Schoology should do. So we've actually hired some of the trainers from that training at IU 13, and they're going to be coming out to us in June so that the rest of the colleagues in their grade levels can see. One woman specifically does nothing but Schoology with kindergarten students and what they're doing with little QR codes and things like that. So I think it'll be a great opportunity for us, like I said, to kind of close that loop for this year and get our mindset ready for what we might be doing next year with Tier 2.
Okay.
All right, thank
Yep,
you.
thanks.
Okay.
All right, so the last thing I want to mention is we don't have textbook adoptions on our agenda tonight to specifically be talked about, but Dr. Kearney has the textbooks for next month here on the counter, and they will be in the superintendent's office for the next month. So anybody that wants to take a look at them, look them up, write down the ISBN number, read about them online, there'll be an opportunity to do that between now and next month when we talk about them in more detail.
And then they'll be on the June business agenda for adoption?
That would be the plan.
Okay,
So you have time to see them ahead of time.
good.
All right?
Good. And then let's move right into,
So we're going to move into the PAYS data
PAYS,
first. So
okay.
we received our PAYS data earlier this year, and we spent some time shortly after we got the data. Christine Storm actually came out and met with all of our administrators and reviewed the data and talked about it with us at Ed Council. Shortly after that, we scheduled another time, and we had both Dana and Christine out to work with our guidance counselors and social workers and to look at the data again and talk about some of the things that we are doing, some of the things we could shore up. But we thought, since we were going to be looking at the wellness study tonight, and that data, much of it is going to overlap, and we invited them to come back tonight to not only talk about the PAYS data itself, but to also let us know a little bit about the types of supports they provide for Radnor and the types of possible supports or possible help they could give us with as we move into our planning for the recommendations with the wellness study. So I'm going to invite both Christine and Dana to come up. They have a short presentation. We'll go through the PAYS data. They can answer some of your questions, and then we'll jump right into the wellness report. All right? All right.
Good evening.
All right, so you have your microphone on.
Welcome. Thank you for joining us.
Having us.
I'm going to give you the mouse so you can be in control. Do you want to introduce yourselves and then we'll...
So, good afternoon. My name is Dana Ratchko, and I'm the Prevention Program Specialist for the Delaware County Office of Behavioral Health in our Drug and Alcohol Department. I'm here tonight to talk about PAYS because our office plays a big role in PAYS. We are kind of the agent that helps PCCD talk about PAYS with school, get them involved. Our providers that we contract with reach out to schools and help them get into PAYS, take the PAYS, and gather the data. So that's how I'm involved with PAYS. And I do want to commend you all for sharing your local school PAYS data with your parents and families. I think that'll give parents, the idea that they should be having those intentional, clear conversations with their children about drug and alcohol and mental health, which is really important. Unless you see those numbers, I think it's not as jarring and as important for you to be talking about. So I did bring handouts for you all with my card attached, as well as not all of the programs that we offer, just some examples from K through 12 that we can offer, and also for families that are surrounding drug and alcohol prevention, as well as mental health. But all of the Sorry, but all of these programs, they're not just teaching kids about the risk and dangers of drug and alcohol. They're talking about clear communication, risky decisions, good communication skills, good decision-making skills, and of course that drug resistance skills. And then we also have programs for parents and families as well. And we also fund mild intervention programs. So you'll see on the list, those are things like Living with Purpose and Teen Intervene, where maybe you're worried about those students that already have those risky behaviors and maybe have used a couple of times, and they're able to meet with a prevention specialist one-on-one and in small group and kind of get that tailored prevention rather than just the group prevention, which is really nice. I also brought our mental health and drug and alcohol directory, and it's all of the providers that our county agency contracts with for mental health and drug and alcohol. And then I also brought a card for Laura Kubler, who couldn't be here tonight, but she is would basically be like the me for the mental health unit. So any of the mental health questions and things like that that you would be more concerned about, you could contact her.
Thank you.
Okay, and I'm Christine Storm. I'm Regional Director of Education for Caron Treatment Centers, and Caron's an addiction treatment organization here in Pennsylvania. I've worked for Caron for 15 years in their education department, so we're more the prevention and early intervention wing of Caron, and we support the student assistance programs that exist in Pennsylvania area schools. And we've been fortunate. I think we're coming up on our 10th year of contracting with Radnor School District, and we've had the same staff member the whole time, and she supports the middle and high school all week long, and absolutely loves what she does. So she spends her days running support groups for students. anger management, stress management, grief and loss, supporting children with addiction in the household, some that are related to substance use prevention or early intervention. She sits on the SAP team meetings and is a referral source for some kids. So she'll have a caseload of students that she meets with on a regular basis to check in with them. And she can also help out with behavioral health assessments that Dorothy Lowry has, if she has an overflow or she thinks Nadine would be the most appropriate person for that. So that's a little bit of what we do. I'm not involved with the administration of the PAYS survey or anything, but helped the last time Radnor participated in 2011 with the PAYS data, with taking a look at it and helping to come up with some ideas and strategies to address what some of the areas of concern were. So I was asked to do the same this time around, and was pleased to be able to do that.
Great, thank you. All right, so you want to jump right in?
Sure, we can jump right in. Do you want to kind of talk a little bit about the background of the survey? Any of the stuff that's up here?
Sure. So, I mean, the survey is biannual, so it's every 2 years. They survey 6, 8, 10th, and 12th graders. So they're hitting the same students every year. And, you know, it doesn't just ask drug and alcohol questions, mental health, food insecurity, homelessness, bullying, self-harm, those types of mental health and drug and alcohol questions. And then, I mean, on our end at the Drug and Alcohol Office, this is how we inform our plans every year through the state, is through this data, and how we choose our evidence-based and research-based programs is based off our countywide data.
And something else that PAYS does is they compare your school to the rest of your county, to the rest of the state, and then the national survey called Monitoring the Future, which asks very similar questions. So it's just, I guess, a way for you to see how you're faring in terms of what is going on nationally and in the rest of your county. So you'll see, we'll start first with substance use results. And, you know, we'll go through this pretty quickly just for the purposes of time, and we'll focus as much as we can on the risk and protective factors, and then areas to address, because that's the good stuff, right? But these are some charts coming up with your substance use results. So if you have a magnifying glass, you can see this tiny information here. So what they do in PAYS is they take a look at daily, past 30-day, annual, and lifetime use of the major drug trends that are out there. So this is what came back in November of 2017 with your 6th, 8th, 10th, and 12th graders. And what I've done is just highlight ones that came across as being a little bit larger than state average. Just in general, Pennsylvania numbers tend to be a little higher than the rest of the nation. And you can have your theories as to why that is. But this is what came back for Radnor. So obviously alcohol is at the highest level, and the other ones that are of concern are marijuana and vaping. So you'll see that trend going throughout this. And please ask questions if you're not sure what any of this stuff is. We can get more into it. That's a whole training in itself.
When you say higher than what? What's the average?
It's all in here somewhere.
Is it higher to the point that we should be really concerned? Is it higher to the point that we should be very concerned about it? Or
There's a couple of things that we'll take a look at that are significantly higher, like almost double the rate of what we're seeing in other areas. So, and that's not totally abnormal for the schools that are surrounding where we are. But in terms of like what we're seeing nationally, they would be things that really jump out.
Okay.
Okay. So this was also, instead of lifetime, this was past 30 days. So this is at the time of this anonymous survey, what have you done drug-wise in the last month? So this is what came back. So you can see, again, we highlighted a few that just kind of jumped out as being a little bit more than what we saw in the state average. And it wasn't significantly more for some of these. Okay. We will get to the areas of concern, but first let's talk about the great stuff that we found out. So in comparing your 2011 data to your 2017 data, there was a lot of really favorable things. Like we saw a decline in most categories. So if you're just comparing yourself against yourself, that's really good. Lifetime use of marijuana amongst district 8th and 10th graders is well below state and national trends. So that's great. In the world of prevention, we try to delay the onset of any substance use for as long as possible. So if we see really low numbers with 8th and 10th grade, we look at that as being really good. The potential for them developing dependence goes down the older they get. The use of inhalants, which is using, cleaning products and other poisons, basically, that exist in our world in order to get high, is very low for your 8th graders. Cigarettes and smokeless tobacco, much lower than we're seeing in other areas of the state and the country. Prescription narcotics, so your opioids and your opiates that we are in epidemic levels of hearing about, overdoses in the news, their use is low with your district, which is fantastic. Selling of drugs on school grounds has declined significantly since 2011. Okay, so you can see that it was cut in half. So that's wonderful. And Radnor students are reporting higher level than the rest of the state of involvement in pro-social activities. So they're getting involved in really positive things like volunteer work, faith-based organizations, and things like that. Okay? So that's some really good stuff. Yeah. Well, we always look to pull from the good to address the challenges, right? So some of the areas to address, one of the areas was alcohol usage, okay? So good news, past 30-day drinking rates declined for your 12th graders between 2011 and 2017. So I do have in this chart a comparison of your 2011 and 2017. So we can see some slight decline, but your lifetime and past 30-day alcohol use rates for all age groups were higher than we'd like to see them.
Can I just ask, and only because, I know we have some smart kids in our community. When is the alcohol, can you tell me what the alcohol question is? I can just see there being kids like, I have communion wine every weekend. So yes, in fact, and I want to know that the question doesn't kind of
Right.
leave that kind of
Do
question.
you know exactly how it's asked?
I do believe it asks, have you had a alcoholic beverage, wine, liquor, or beer in the past 30 days, and then in your lifetime? And actually, if you do go on the PAYS website and pull up the survey, in the beginning of each tab, like one for alcohol, one for marijuana, it states the questions that the children were asked.
I feel like, does it say more than a sip? I feel like it says something like that, to try to suss out, like, I had the communion wine.
Yeah, or, my dad let me try champagne at somebody's wedding, and, okay. That's, I was just wondering.
What gets a little bit more clearer is, I think the next slide is binge drinking rates. So this is going to clear that up. Your binge drinking rates is 5 or more drinks in a row. So 5 or more drinks in less than 2 hours. And binge drinking rates, again, have declined since your 2011, but they're still pretty high. Of your seniors, 36% binge drank in the last 2 weeks prior to the survey being done. Okay? So certainly something we want to keep an eye on.
So, and then also not to undercut this, but I'm sure there are people who are going to say, like, are there kids out there playing with the survey?
They do add in questions for validity purposes, so it'll ask, have you ever used this drug? And it's a random made-up drug that doesn't exist, and, kids who mark yes, their surveys get thrown away.
Okay.
So there is, throughout the survey, ones to kind of weed out those kids who maybe aren't being so honest.
Okay, and probably they're the kids who think, I don't care how anonymous this is, I'm not admitting to any of it, so maybe there's a balance. Okay.
I think they try to ask the same question in a couple of different ways to again, check for consistency. Marijuana usage, okay? So although lifetime 8th and 10th grade marijuana use rates are much lower than the state and national average, by 12th grade, we're seeing a big jump, okay? And that is not surprising. We've seen across the board a decline in most drugs over the last couple of years, but because of legalization and decriminalization of medicinal marijuana, the perception of harm with this drug has gone down. So the rates are a little higher than they have been in the past. So you can see where you guys are coming from 10th grade to 12th grade, the number of those who have used have jumped in the last 30 days. Okay?
Can I just ask you about how they ask the questions? Is there any possibility that that our numbers are inflated because kids want to impress other kids in their class?
It's possible. I mean, they don't see what the rest, until this comes out, they don't see what their peers filled out.
Okay.
Yeah. And usage is different than it has been in the past. So we're seeing, kids are still smoking marijuana, but we're seeing it being vaped at a higher level. So when we're talking about, they ask questions about vaping, and then they're asking to the students, what are you vaping? And the oils and the waxes are something new that didn't exist in 2011. That is a trend that we need to address, because those have high levels of THC in them. So just some pictures of what those look like. And it's challenging for schools when they confiscate vapes to figure out exactly what was in them. They often have to do testing. So this was probably the biggest trend that it's not just you guys, it is across the board. The FDA is calling it an epidemic. Some are saying that that's exaggerating things a bit, but a lot of kids are vaping. So the use of electronic vape devices, you can see Radnor, 6th grade, it's still very rare for a student to be vaping. By 8th grade, you can see about 18%, by 10th grade. And this was in the last 30 days of the survey, half of seniors had used a vaping device. They asked them what was in it. There's a good percentage that have no idea. Some that are saying just flavoring, many that are saying nicotine, and some that are saying other stuff. So the oils and waxes and things. And just another, and this is not terribly surprising, whenever you have a private school or a suburban district where kids are very academically motivated, you will see higher rates of kids abusing Adderall and prescription medications that they believe will help them achieve a leg up in school. So those rates are what they are, you can see here, compared to what we see in other areas. And this is just a couple of the other things that stood out. It's the last couple of years, students have reported, and this is all of the schools that we work with in the mainline area, that cocaine is making a bit of a resurgence. So that was a little bit higher than state and national average. 22.4% of District 12th graders reported being drunk or high at school at least once in the last year. And an elevated driving under the influence of marijuana. Okay.
What is powered?
Powdered.
It's definitely missing a D.
Well, that's
I'm usually the one that picks up on those things. I missed that. Thank you for pointing that out.
Okay.
Yeah, I don't know what powered cocaine is, but it's all powerful.
Woo.
Okay. Any questions on the drug section? We'll talk about some recommendations. Did you have anything else that we didn't get to that you wanted to point out? Okay.
I mean, I think overall, all of the school districts, alcohol, marijuana, and vaping, that's the three biggest concerns in all school districts in Delaware County. So I think the thing maybe Radnor wants to focus on is that amphetamine, Ritalin, ADHD medication use, and of course the gateway drugs, but just like the general prevention and education for those, just like the rest of the school districts need those as well. I don't believe that the students think that those amphetamines are addictive or that they change the way their brain is working and thinking, because it is from the doctor. Same thing with opiates, this, but so I think focusing on that is probably important.
Right, and there's zero evidence that it actually helps you if you don't need it to perform better in school. So, mental health results. So, Radnor students report a lower rate of self-harm than the rest. A lot of these mental health questions were not asked in 2011, so we can't compare how you guys did previously. So you can see where you showed up, and self-injurious behavior encompasses a bunch of different things. Okay. This is frozen for some reason?
Sorry.
Okay.
Uh-oh.
Is it officially storming outside? Because it looked like it was going to be.
I don't think so.
Okay. All right. Okay. Was this self-harm? Okay.
Your self-harm.
All right, depression and sadness. Radnor students report lower rates of depressed feelings than the rest of Pennsylvania, but higher than they did in 2011. So you can see that that even starts in 6th grade with kids reporting that. I don't think that is a Radnor thing. I think across the nation, we are seeing higher rates of depression, anxiety, and other mental health diagnoses. Feelings of failure. So Radnor students report lower rates of feeling like a failure than the rest of PA, but higher than when surveyed in 2011 by quite a bit. And I think we can look again in a big picture of society in general. Social media wasn't what it was in 2011, and kids comparing themselves to others is happening at a much higher rate because of those kinds of things. But that's something that we could look to address. But still better than the rest of Pennsylvania. And then suicidal ideation, I can't believe that that was not surveyed in 2011, but this is where we are at in 2017. So having considered suicide in the past 12 months, okay? So that's what came back from that. And then this was actual attempts to take their own life. So it's pretty jarring to see those numbers, but again, that's not a Radnor unique situation. As you can see, compared to the rest of Pennsylvania, your numbers are much less, especially with the younger students. And bullying. 26.8% of students in the district indicated experiencing bullying in the last 12 months. That's pretty comparable to what other schools are seeing. And some of the reasons they put are, I don't know why. That's a large portion of them, or something related to the way they look, or for some other reason. And it's interesting that they take a look at usage, substance use rates, and mental health together to see what the indicators are. So past 30-day alcohol use rates are 4 times higher for students who report depressed feelings than for students who don't. So there's some self-medication going on there, which is not surprising. And then past 30-day cigarette use, 7 times higher for students reporting symptoms of depression. And for marijuana use, 3 times higher. When taking a look at risk and protective factors for the district, the 3 greatest risk factors that came back for Radnor was kids thinking that their parents have favorable attitudes towards antisocial behaviors. So those would be behaviors related to substance abuse and other things. And then feeling rewarded by their peers for doing the wrong thing. So being perceived as cool for maybe using marijuana or skipping school or something like that. And then there was a tie for perceived risk of drug use and favorable attitudes towards drug use. So the perceived risk is one that I think is pretty easy to combat. It's students thinking that there's not a lot of health or safety risks associated with use. There's a lot we can do to combat that. And then favorable attitudes. So again, thinking that this is kind of a cool thing to do. And again, chime in if I'm missing anything. And then your greatest protective factors, and this is great stuff. This is all related to family. So family attachment. 75% of kids said that they feel very attached to their family, that they have good relationships with parents, and we don't see that across the board. And then family opportunities. So kids are involved, and they're being given opportunities to be involved in things that are positive, and then feeling rewarded for being involved with things that are positive. Some recommendations, okay? So some of the things that we take away from this survey is that there are some students that believe their parents and peers are very supportive, either actively or passively, of their substance use. So seeing what we can do to, there's something called social norming. So when we get kids to see that it's actually more normal to not get involved with substance use, that can create more of a positive spin on non-use. So we need parents to also be giving this message consistently that this is not something that they want their kids to do, because many are seeing some passive permission going on there. Perception of harm, in order to address this, continued education. So it's a lot of like, keep doing what you're doing, and maybe aggressively target a couple of areas. So continued education on the physical, legal, emotional, and other risks associated with use. The social norming campaigns, like I said, again, kind of normalize non-use, focus on the kids that are doing the right thing and not just kids that are doing the things that they're not supposed to be doing. And since we're seeing such a jump from 10th to 12th grade, like really addressing a lot. I think in our health and safety curriculums across the board, we tend to do a lot of anti-drug stuff in middle school. And then because there's so much to address in the high school level about sexuality and driving and all those things, sometimes it's not addressed at the level that it needs to be. And as kids get older and parents pull back a little bit more, we're seeing the rates go up much higher. So for stimulant abuse, it's not unusual, as I said before, for these academically rigorous environments to have higher levels of stimulant abuse, but educating that there's really no link between the two could be helpful. Vaping, continued presentations and conversations on the dangers, monitor where these things happen most often, which really is in the bathrooms, okay, and in the hallways. Because of the peer influence, we know that student athletes have a lot of sway over the culture of a school. They tend to be ones that could be considered more popular. There are a lot of programs out there that kind of target student athletes to decrease their substance use. And then partnering with your police department to talk specifically about community trends and things that they are seeing in the community. And then because we saw the rate of students coming to school under the influence, it's always a good idea to just keep faculty up to date on what the current trends are, signs and symptoms that a student might be under the use, the influence, and then where to refer kids if they're having concerns. So my focus is certainly more, because we're an addiction treatment organization, on the substance use stuff. Is there anything that I missed about, like the mental health things that you guys offer or would be recommended?
So again, I'm not really the mental health unit, but when I did speak to my colleague who's in the mental health unit, she said she'd be more than happy to meet with you all again about some things. But one thing, 2 of our mental health specialists are getting trained actually this week on trauma-informed care, so trauma 101 to 106, which is basically classes that they'll be able to teach after they're master trainers. And that's for professionals, families, parents, and this one does include students. So they would be able to come out and train your students on trauma-informed care, kind of how to talk to their peers and different individuals. You know, I think our students probably see their peers struggling maybe even more than the adults do. So them being able to kind of have a conversation with their friend about mental health and drugs and alcohol in a way that's appropriate. For parents, we have a ton of parenting programs. One that I think would be great that I did put in here is Power of Parents. It is teaching parents just about teen brain development and how drinking can affect that. But I think some of the things parents don't know is the laws and fines associated with teenage underage drinking. So it goes into that pretty heavily too. And then on the social norming part, just having signs and posters, even bathrooms. One of our providers have something called stall stories that they could make specific to Radnor, saying, 80% of the kids in your school actually don't drink alcohol, and this is why, and other fun things to do besides drinking alcohol. So those are kind of the social norming things that you could do that's a little bit easier, and that you would ensure that all kids are going to be able to see and get that information.
So I apologize. I think you said this at the beginning when we were passing out paper. This survey hasn't been done since 2011. It looks like there was a 6-year lag time. Is that the standard? It's only ever done every 6 years?
No, it's done biannually. It's a school district decision to take the survey or not. So the one in the next school year coming up, the survey will be administered again.
So we can choose to have it done again in this fall?
Correct. Yeah,
Okay.
it is. Yeah.
Got it.
Yeah.
Okay.
We made a decision to participate, and this is something we can continue to discuss as a board. We feel that the data is helpful. I think all the questions asked earlier about Can kids game the survey? And the survey, I think, has been around since late 80s, I believe.
I took it in high school, so it's been
Yeah,
around a while.
it's been around.
I remember it.
And I could tell you just from past experience that they have tried to adjust the survey every year to ask a lot of questions to try to catch those kids that are gaming it. It's still possible. It's still possible that on either end there are exaggerations or under or over that still take place, even though they, work hard to put those types of questions in there. But as we look at our comprehensive wellness, pieces, this is one more data point for us that I think is important for us. In our next presentation, I know they're going to discuss some of the PAYS data as well, and also discuss they're sharing data as part of the wellness presentation, which is next, but they're also going to share some of the things that we do, even though the recommendations are coming in the fall, but just to give the board some updates too on some of the things that we do have in place, so you can start to gather a little greater context for things as well.
Well, thank you very much. I appreciate you coming out.
Do we have a question?
Oh, you going to do questions?
Just one question.
Yeah.
What is the SBIRT training?
Oh, so that SBIRT is screening, brief intervention, and referral to treatment. So it's an evidence-based process. So we know that substance use disorders are preventable. And just like a lot of other diseases, the earlier you catch it, the better the outcomes are going to be. So it's a process that exists in hospital systems, in pediatricians' offices, and also schools are a place where this can happen. And some states are looking to make it a mandate in schools. New Jersey is going that way. Massachusetts, it's already been a mandate where there are certain grade levels where every kid is given a screening to see their risk factors. So it kind of catches those kids. It's all based on the honor system. But it catches those kids that are hopefully early on in their substance use, and then they can be recommended for the next level of care, which might be a more thorough assessment through the SAP team, referral to an outpatient provider or something like that. So that's just an example of something that can be done that's universal and put into place each year. It's a pretty big undertaking, but some districts are making it happen.
So this is considered, do you have recommendations on something like this?
Mm-hmm.
Would you
Yeah.
recommend that it would be?
It's definitely something we could talk about. Caron has been delivering SBIRT trainings across the 5 counties surrounding Philadelphia this year through from funding that we had. So there's more districts that are looking to get on board with this. So we could put you in touch with some of those other ones. But there are some already existing screening tools that take just a couple of minutes sitting down with a kid to ask a couple of questions, and then you have a little mini conversation with them about what some of your concerns are and some of the things that they're doing that are really great. So it's a positive connection for kids.
So that could be wrapped into the wellness, or am I
Possibly.
kind of, something like that? Okay, well, thank you very
Thank
very
you.
much. Who's the director of the Department of Human Services right now?
Sandy Garrison right now. She's our acting human services director.
Okay, all right, thank you.
All right, so we'll invite our wellness group up next.
All right, good evening. We're happy to be with you again to give you an update on the Student Wellness Survey and study, pardon me. You may remember that we were here in February to talk to you about sort of the scope of the study at that point and also our primary sources of data, one of which was the PAYS survey that you just heard about. So although there's some PAYS data in this presentation, we're going to skip over those items that you had just seen as part of the previous presentation. We're fortunate to have with us most of the Wellness Study leadership team here. Dr. Kane and Dr. McKnight were instrumental in gathering information about social, emotional, behavioral wellness in the school district. Dr. Kent was involved with gathering physical wellness data. And Mrs. Riley from the DCIU, unfortunately, is unable to be with us tonight. She's at a recognition at the IU and also doing a presentation at the IU tonight, but she was involved very much with college and career capacity wellness. So today is our second update on this board goal, where we're going to go over our preliminary data and findings. And we're scheduled to present the wellness report with recommendations in fall of 2019. So although we may be talking about some things today, the focus on the final report and recommendations will be in the fall. And as you've heard, we had divided the study up into these three primary areas with subtopics under those. So these are the ones that we're going to address primarily today. Certainly all of these are connected to one another. We're well aware and have learned even more about the significance, particularly of social emotional learning, to not only academic achievement, but also student involvement in their communities. And although we'll touch on some aspects of academic achievement today, again, a lot of that data was presented back in November as part of our academic data presentations, although we will bring in some aspects of that to this tonight. So the way we thought about the presentation is we would take these one at a time and allow the opportunity for questions after the end of each section, if that's all right with you. Okay. So we'll start with Dr. Kane, who's going to talk to us a bit about social emotional behavioral wellness and what we found in the district.
Thank you. I was really pleased to be able to provide a little theoretical orientation and approach. So social emotional learning, in terms of incorporating that system, has been really helpful because it's based on prevention type of model. And it's also based on learning theory. And the idea of this is that there is a continuity between community-based resources and schools. And trying to really understand what are those critical skills that students be able to learn. And not only that, learn them, but learn them and practice them and utilize them throughout all aspects of their life. And which is very important because we need to have that transfer, and that really helps kids grow and learn. It's definitely on a preventative, positive-oriented model. It's not deficit-based, and it really is helping us to see that skills can be acquired and developed over time. So it's gained a lot of publicity in the press, but I think it offers a really nice avenue in trying to understand and hone these skills and making them part of our everyday learning. So we have a slide here which also goes into the PAYS. Thank you. And it's really helpful to really look at these protective factors, these strengths. With really this approach is to look at how students at Radnor are feeling in terms of their safety. And you can really look here and you get to see this, this jump, and so the blue bar really shows that we have a strength. And if you look at percentages-wise, it is a 5% difference is significant with the PAYS. And so looking across, you get to see some strengths. They're really helpful. So safety certainly is one of them, but also the chances to talk one-on-one with the teacher or really to be part of the learning. And schools having this emphasis on learning is one of those key factors. So PAYS really has broadened this and look at student commitment to learning and really climate as part of the whole child approach. And so I think one of the strengths here is that really shows is that the student-teacher relationship is a strength. And I think that's predicated upon the strength and attachment the parents have with their children. And I think that shows up here. And I think that also provides a really strong basis for learning and supports. It also has a major impact on social-emotional learning and wellness. And the more that teachers have a collective approach and belief and the self-efficacy or the belief that students can grow and learn has a better outcome. So I think that's really a strength here. We also have, in terms of other comparisons, and the value of school. And that becomes really important because we're really trying to look at how students have meaning and how do they understand a role that they have an impact on their lives. And so having that ability to feel that they can have an impact or that work or school is meaningful becomes very protective. And it gives them a sense of optimism. So it counters these depressive features. So we really want students to be able to feel like that they have an impact. We also looked at students that had depressive features on the PAYS, and those students who did report that were also actually involved in a lot of school activities. So students in general, and then those who had risk factors were also involved, and that's really protective as well. And we touched on these prior slides.
We're frozen again.
It was mentioned earlier that anxiety is a highly concern for teens as well as depression. It's the number one. Bullying is second with a concern. That's from the Pew research. It's national research. So the PAYS doesn't measure anxiety, but certainly perfectionistic anxiety and the correlates with relationship with stimulant use is there in literature. That's all right.
Can I ask a question while he's rebooting? You talked a bit about it, but the slide that was perceived importance of school. And I guess, I mean, I see that we're still above the state average, but those numbers seemed on the low end in terms of, less than half of our students feel the assignments are worthwhile or meaningful. I mean, and the same with, it was disturbing to me, just because I have two kids who love school, but it was concerning to me that less than half of our students say they enjoyed being in school in the last year. I mean, obviously, some people are cranky about taking a survey. I think they're, but I mean, is that something that you're looking at? Were you surprised by that, given your role in the district?
I think I was a little surprised by that. And, this is the first time that PAYS is measuring this area. So, I hate to make a conjecture about that or,
Okay.
But I think that it is an area of focus. And having students connect the value of it to then long range, such as career, I think is why, this board is, considered and talked about 339 planning and that kind of thing. So I think that makes sense.
Okay.
Yeah. It's a good question, though.
I think it's also an example of area that we probably want to drill down to a little more. I mean, I find it fascinating when talking to my children. I have a freshman now in high school who works very hard on her own, but, when I ask her about school, she doesn't necessarily have real positive things to say about the work, but yet she's driven. So it's an interesting dynamic. So it's something that I think we want to drill down a little bit more and talk to kids and, and have some maybe focus groups with some of our students to understand it, because I was surprised by, some of those percentages as well.
Yeah.
Yes, and looking at social emotional learning is to really derive meaning from this work and see how it's connected to their lives personally. And I think that really bodes well for looking at social emotional learning and how that might maybe influence and help those scores to go up.
Do you think if you were to look at the word enjoy, do I enjoy something? Do I enjoy vacation more than I enjoy school? Do I enjoy, so I think the actual word itself is troubling.
Yeah.
Which even the importance, now that does the importance of school later, that's a tough question, and I agree, that's a bit of a troubling one, whether our students understand what they're going to school for, and so maybe that's something that we need to look into and attach. There's actually a meaning for why you go to school. It's not just you're here due to the fact that if you don't come here, it's truancy, and there's a real big issues that would be in there. And the other piece about the assigned schoolwork, I'm curious whether sometimes you might look at that as that homework. And I think that's something else that we're looking into. So we're actually addressing a lot of this. It's just sometimes when you're filling something out, the actual words. Now, did you take the test? Did you take the survey? You did not? Okay, well, then I won't bother you.
If he did take it, his answers were anonymous, and we're going to respect that.
No. I'm just saying the words in the question, like enjoy.
Yeah.
If you were to look at it, what would you?
Yeah, I was thinking the exact same thing. Enjoy, I think, is taken as a relative term. So when you ask someone if, particularly about school, if they enjoy something, I think they're most likely to compare it with something that they really do find more fun. So if they think back to the weekend or the upcoming summer, I think they're going to be more inclined to say that they don't enjoy school just simply because they're comparing it to something they enjoy more. So like Mr. Madden said, I think the wording, if it were changed, you'd see a significant increase in how many people, maybe if, and I'm just coming off the top of my head with this, but like if you said aren't inclined to skip school or don't have a negative association with school or something like that, where you're taking away the comparison factor, I think you'd see a significant increase.
Thank you.
Thank you.
We're back up.
So this slide really articulates the need for understanding in terms of what supports and social emotional learning and how that fits within other systems of support, such as student assistance. And what this really is trying to do is to help provide a framework for which we provide these resources and supports and instruction and the social emotional learning and the different areas of competencies that are really helpful in terms of overcounting, and helping to offset some of those risk factors that we talked about. So we really need to be able to have a sense of where we need to go, how our base in terms of healthy wellness development and that prevention efforts, because the more that obviously goes into that and is more efficient, then we can help offset then the later and more intensive services. It'll also help to reduce staff burnout, those kinds of things. So we begin to look and try to put some mapping in terms of what resources we have within the district, and to try to look at this in terms of different supports that provide that structure that is helpful in terms of making a program that's evidence-based and to make the implementation effective, because it's two separate needs that we have in order to implement programs with evidence. We also have to look at, one, is the program or the instruction sequenced? Is it active in terms of the learning? Is it focused and explicit? So the integration within gets the most bang for your buck. The more you do the integration with the skills of SEL and blending within the curriculum and the learning, that makes it richer, and that helps to offset and creates more meaning in the learning. The highlights are that we have some schools that have a framework, such as school-wide positive behavior supports, and that's a system that's throughout the state, supported system, and that provides that structure. But what makes it an evidence-based for social emotional learning is when you add that element, that helps the skills to be sustained, and you're creating more change and growth over time. For the middle school age, it's really important to look at how that system then carries through. So we have a Raider Day. We have a program where we're building relationship skills, student-teacher relationship, but then also building self-efficacy, the belief that you can achieve and grow. And that is an area through goal setting that becomes the framework that all students get beyond the wellness instruction through health or even facts. And then we also introduce the idea of social emotional coaching to improve teachers' success in implementing the social emotional learning within the curriculum. And that becomes really important when you're looking at the high school level. And you can see that programming starts to increase in terms of some of the need areas. One of the key areas that is a strength is the equity and trying to address and increase skills of minority groups or those who are maybe at risk. And so that preventative work is helpful in trying to increase that relevance and understanding life skills and how they apply to make the learning come to life and see the value and the long-range career connections with it. So I think that's a strength. There's a compassion project that the district had recently, and that's another example where there's a cross-integration between what maybe an elementary school is doing and then cross-district with a high school partnership. And those are incredibly valuable because we want students to have that connection and to see that people do grow and develop. So if there is bullying at elementary school, the high schoolers give that advice and realize that it does end. People do change, and having that belief is very protective when it comes to bullying. And we're also trying to increase self-awareness. Self-awareness is a really key skill in terms of that, as well as relationship skills, because we want to help kids to develop those resistance skills and to show that, yes, other students are not using drug and alcohols or substances, but we want to also offset and give them better relationships about talking about difficult subjects that we need to have the students learn and develop and grow on. So this slide provides an indication of how frequent teachers are implementing social-emotional learning, and you can see it's pretty frequent. So I think this is critical because we're trying to have the learning and the social-emotional learning work in tandem, and that's really how these skills grow because they can understand how they apply.
Dr. McKnight took a look at discipline referrals as part of the study.
Research tells us that students who are repeatedly involved in school discipline systems are usually so because of unmet behavioral health, academic, or other needs. So what we did for our studies, we took a look at the discipline referrals for the 2017-2018 school year for all three different levels. Those that were reported and recorded. And what we found was the very first bullet up there, that there was a variance between the fidelity with recording those statistics, which then sort of confounded our study, but we still went on and learned that most of the behavior incidents that we saw in the system were relatively minor. And our discipline system is set up so that there are three different levels. Basically, the first level are 85% of the things that happen in schools happen in classrooms that are handled by the classroom teacher. The second tier are those things that are usually referred to an administrator within the building. The third tier are those things which are referred to administrator and then further assigned to someone who's in a support position to provide interventions other than those kinds of consequences that we might. So the statistics are up there. What we are doing now, in addition to already starting to impress upon building administrators to collect the data with more fidelity, we're also drilling down the data to try to identify certain groups of students that sort of self-identify as being more needy than others, and then looking at interventions that we need to develop in order to better meet their needs so that we can reduce recidivism. That's basically, and again, the goal is to make students aware of the things that they do that need to be improved upon in order to be successful in life. We're not just worried about the school context. We want to go the whole way through and make sure that they're aware of it. So we learned a lot. We have a lot yet to learn, but we've already started to make some improvements and enhancements.
We also.
So can I just to clarify, what you're saying is it's not that our high school students behave that much worse than our middle school students, it's that we probably weren't necessarily tracking it the same way.
And there are offenses that potentially can occur in the high school. And I'll just give you one random example, class cutting.
Mm-hmm.
It's almost impossible to cut a class in middle school or the elementary school. In the high school, with a more open environment, there's a potential for more of that. So that's just a quick example.
Got it.
Lateness as well.
Right,
yeah.
being late, right. There are students that don't drive to the elementary or middle school, but they drive to high school, and therefore they can be late. So there's the potential for greater numbers, but there's also a lack, perhaps, of fidelity in recording them. But again, we're already addressing that, and we think
Do we think that the lack of fidelity was in the recording or the actual dealing with? I guess is my question.
I would suggest that probably every discipline incident in any one of our schools that was reported was dealt with. It was
Okay.
more in the recording and reporting. But again, we need that data in order to develop the systems. So we're going to do better next year, and we'll have better data. And that's all I'm saying on discipline right now.
We also surveyed our middle school and high school students about homework and some of the things that they're involved with as far as time. We asked the students how many minutes of homework do they do on a typical weekday, and you can see their responses up on the screen. The yellow line up there indicates both those students who indicated the highest amount of time spent on homework at the high school, more than 225 minutes on a weekday, and then at the high school at the middle school, more than 90 minutes on a weekday. And those are also gives us some indication where we might be exceeding the average homework from our policy 130 AR, which says that the average at the middle school is 60 to 80 minutes a day, and at the high school it gets a little bit more complicated because it depends on the student's schedule and the levels of courses they're taking. But if a child were to be taking 5 AP and or integrated courses, that would be up to 225 minutes a day. We have a student.
I was smiling at Asa, knowing how many AP exams he has this week.
Does this data look about right, Asa?
Yeah, that seems pretty accurate.
We also asked them, among other questions, about their involvement in other activities, and our students, as we heard before, are very involved, which are protective factors, but they also consume some of our students' time with other extracurricular activities. And homework does conflict with these, with extracurricular activities, family, friends, et cetera, for our students from time to time. 64% of the high school students said that homework or schoolwork often or always keeps them from having time for family, friends, and other activities. 46% of students at the middle school indicated always or often. And they do feel stressed by school and their academic experience as well, as they told us in this survey. The 2 bullet points at the bottom there were responses to an open-ended question we asked students. So when they were asked what in their life causes them the most stress, the top 5 responses that they said at the high school were school, homework, tests, grades, and college. At the middle school, school, homework, tests, projects, and sports. I think it's worth noting that this survey did ask many questions about homework and school and whatnot, so they might have been in that mindset, but those were the responses to those questions. So overall, for the first component of the wellness study, I think you heard a lot of the findings as we were presenting the information, and also from the PAYS presentation. Substance use and instances of selling drugs on school grounds has declined since 2011. However, e-cigarettes and vaping is increasing in Radnor as it is around the country and the state. Our students report a higher level than the rest of the state in involvement in pro-social activities. However, many students believe that parents and their peers are supportive in one way or another of substance use. We are responsive to the mental health needs of our students, including those students with addiction, and we have students who are reporting lower mental health problems compared to Pennsylvania, but it is a growing concern. There are strong student-teacher relationships in the school district, and students feel safe here as well. We do notice and see some inconsistency in the vision, the language, the values with regard to social-emotional wellness across schools in the district, so likely that will be an area where we will be able to show some improvement. And similarly, we see an emphasis, and you may have seen in the screens that talked about the tiers of interventions. We have a breadth of programming dealing with social-emotional learning. In some cases, we think we might be able to go a little deeper with perhaps fewer programs. As was already said, there is inconsistent collection and use of the discipline data. So it's not particularly easy to pull out some of the information and answer some of the questions that we might have wanted to drill down a little deeper into. And although 3/4 of Radnor High School students received no discipline referrals, in 17-18, a small group of students received more than half of all the referrals during that year. And there is some concern that we may be exceeding the AR with regard to minutes of homework for some of our middle school and high school students. Are there questions that you have from this first section?
Yes, I have.
Any questions? Anything catch your attention?
Yes, actually, it does. We had a meeting at the high school where NAACP came, if you recall. And they were concerned about the amount of minorities that are being disciplined at a considerable higher rate than non-minorities. And I was wondering, what do our statistics look like? I don't need to know right now, but that's something that we had promised the local NAACP to come back and discuss with them, because we are not alone in this situation. I mean, this was, other districts surrounding us were facing the same situation. So I think we have been taking measures to look into that, and that brings me to in servicing teachers so that they understand their own bias when they're disciplining students, and how that discipline, how that level of, now it's an incident, how that comes about. So I think that's something that we need to understand as we move forward.
Yeah, no, that is something that we are still concerned about as a district, something we're continuing to look closely into. Part of the equity and excellence presentation that you saw here last month, part of that was training for teachers, where we brought in and had training at the high school for teachers. We've also had, as part of that equity and excellence initiative, opportunities for different types of mentoring programs that we haven't had in existence before, all in hopes of trying to address that and other aspects of making sure that our community is inclusive and that, that all of our students are succeeding.
I had a couple. I don't want to take the time for a tutorial tonight, but I would love just some suggestions, or if there's someplace on our website or someplace else that I can understand a little bit better the different social emotional learning programs that we've got. I mean, like a divorce support group, is somewhat self-evident, accepted. Is that for students or for teachers? Those kinds of things. I understand what, I know what Speak Up is, I know what the Black Student Union is, but some of the others are a little bit more vague.
We probably should have mentioned this. In your packets, there's a bit of a glossary.
Yeah, I
gives
saw that.
That gives at least a brief description of many of the social
Okay, so that'll explain kind of what they all are.
That'll
Okay.
give a little bit more
I didn't get through that part, obviously. And then the other question I had, when you talked about there's a data review, it's on slide 20 for the teacher survey and curriculum. I guess I wondered, especially since there was a reference to sometimes inconsistencies, whether the social emotional learning components of education are, this is the district as a whole, and it's 260 teachers. I guess my question was, is there more, are we seeing higher amounts of social emotional learning in the elementary schools or in one elementary school in particular, or is it really the teachers are more focused at it in the high school? I guess I'm not sure it's as important for us to know, but I would hope that as administrators, you see where you need to focus on helping teachers.
Yeah, we do have that data by school.
Okay.
Although we presented the aggregate data
That's
here, we
fine.
do have it by school. And we have each of those components of social emotional learning. There were several, maybe 3 or 4 questions about each one of those. You've got a summary slide there.
Okay.
We would say, though, and Dr. Kane can speak a little bit more to this, it was pretty consistent across buildings and even across levels. Our teachers seem to be infusing social emotional learning to one degree or another on a weekly basis, at least, into their classrooms.
I'll jump in too. Just one of the things we, debated with this and discussed, this term in education, we create terms and it becomes a challenge what these different terms mean. Social emotional learning is, unfortunately one of those. But, writing a paper and then receiving a lot of critique on that paper and then going back and struggling through that and then revising it again and then achieving, or on a test. Opportunities where you have struggled through something and then you can see that achievement through that struggle academically is another good example of social emotional learning and those opportunities that we give our kids. So social emotional learning is not just about these standalone programs, and I think that's part of our discussion, is what is also happening not only with the standalone programs, but what are we doing within the classroom academically to help challenge our students, to help them achieve academically, and that it's okay to struggle through a topic or a subject area, and then to see that growth through that intellectual curiosity and that study of that topic. And we had some really good discussions about that early on as we set out.
Yeah, so the two key competencies that are really important are self-management and self-efficacy. And those are critical in terms of predicting outcomes in terms of GPA. So they're really important. So those cognitive skills are critical. And how do we do that, and how do we do that systematically and considering standards, and how does that skill change and grow throughout the years? So we're starting to really understand that more. There's some differences, but it's a new kind of concept, and we're struggling with understanding management of assessing and then programmatically. But this is pretty new.
We have to, as we move forward with this discussion, how we balance what are those standalone pieces and what are those pieces that are integrated, and to make sure we're not pulling away from the academic content.
I was just going to say,
how
we're
do we make
overloading our
sure-
teachers with.
Exactly.
Yeah,
Yep.
okay.
So we need to be very careful with that and make sure that we're not pulling away, but also see, I was thrilled to be in a couple of classrooms at Ithan a couple of weeks ago where the morning meeting time, which is clearly a social emotional learning, but the focus on academics, the focus on that morning meeting time when there was a fraction put on the board and the different skills where students were then using the lowest common denominator to introduce their partner, but then put their sticky up on the board, identify which was the lowest common denominator for that fraction. So there's a lot of tools and tricks that I don't want to say tricks, but tools that the teachers can do that really ties it together nicely.
Yeah, and it increases academic outcomes, 11 to 17% percentile points, if it's embedded within, and then it's also connected and sequenced. So we have to really understand the scope and sequence of these different programs, and that'll help us tie these up.
It's a lot of support for the teachers. And you got to provide a lot of support to make that effective.
So I don't want to dwell on the negative, but I'm going to go back to these two shocking statistics. Where 79% of our students by 12th grade, their lifetime usage of alcohol is 79%, and marijuana is 50%. And we know that this is above state and national averages. What's that? I'm just still, I'm kind of not stunned, but concerned. Do you want to talk a little bit about your responses to that, your thoughts
So,
about it as
In
professionals?
terms of binge drinking, there's some literature looking at binge drinking and what might be related to. And more at the collegiate level, there's questions whether it's academic related or social related. And it seems to be more of the literature supporting more of the social issues that are related to it. So there aren't really clear answers in terms of high school, but there might be other folks here that might be able to share that from Caron Foundation. So.
Yeah, I think as a district, we haven't done this survey since 2011. And there was a little bit of a pushback even to, conduct the survey. There were some concerns, from some parents in our community that are we exposing our kids by asking them the questions? And we had about a year ago, discussion about that, and there's no research to show that you're exposing kids to this type of behavior by just asking questions about it. Dr. Dan and I had talked at length about that about a year ago. But I think one of the starting points for us as a district is to be having these discussions, to be tracking this data and be looking at it and, be sharing it with our community and talking about it. It is very concerning. The decisions our kids are making. We also have to look at a lot of different data. There's a lot of data that will show also nationally that our kids are actually taking less risks than they have in the past, which is interesting. So as we're seeing some of these things are increasing, we also see that some of our kids nationally, some data show that they're less risk-taking, much more tolerant than the kids have ever been in generations before. There's some data to show they're less likely to go get their driver's license right away. There's some really interesting things going on that we need to continue to look at and look at this comprehensively with our students. And it is, I think, by sharing and looking at this data and then, digging deeper with it that we can help not only educate but also program appropriately.
I guess I'm kind of stuck on the fact that, as far as I'm aware, it's illegal for high school kids to do this. But yet, 80% are doing it, well, in one category, half in the other. What do you make of that?
Some of it, unfortunately, is also tied to the other statistic that where does it feel acceptable too, and what things are acceptable. You know, I mean, and I think that is a piece that we need to continue to look at and discuss as well. You know, and you know, this is, I'll tell you, as you know, as you guys know where I am with my kids and the ages, with the high schoolers and middle schoolers and a college. This is the stuff that scares you as a parent, and that you hope that you're raising kids to make good decisions and smart decisions for their life, and you don't put your head, you know, in the sand over what's going on around them. But these are things that are concerns.
Self-management is a skill that's really connected to mental health related types of problems. And, you know, those who are at risk for depressive features tend to gravitate towards those as ineffective coping strategies. So that could show a little bit of this indicator of stress related symptoms, reactions. But we don't know that for certain. Yeah.
Well, I think it's critical that obviously people need to know about this. Parents need to know this. So to the extent that we're, you know, sort of letting the information out, letting this be known, I mean, that's a huge step forward to help address this.
You know, and we, you know, 2 years ago, you know, we added we discussed here at the board level, we added a drug dog to the high school. You know, up until 2 years ago, we hadn't had a drug dog. Now, I don't know if that's some of the change and some of what we saw, some of the decreases from 2011 or not. I have no idea. But I do know from talking to the high school students, one of the reasons why we wanted to add the drug dog to come into the high school was we wanted our students who are choosing not to be involved in drugs to know that we don't turn a blind eye on this, that we're not going to tolerate it. This isn't a good, healthy decision for you. That was one of the things that surprised me, that there was a sense from some students that some of these activities that maybe the administration, you know, is turning a blind eye, oh, this is going on, and they're not addressing it. Well, if we know about it, we are going to address it. And I think the drug dog became very symbolic for the student body to know that, hey, this is not a life decision we want you to be making. We want you making good life decisions, and we're going to hold you accountable for making good choices. And if something's illegal and poor for your health, we're going to make sure that we're addressing it. And I think that has symbolically, I don't know, Asa can comment on it or not, but I think that has helped symbolically let kids know that, hey, the school's not tolerating that on school grounds.
Yeah, I think that's definitely true. And I think part of the problem that we're seeing is people aren't really caught too often, like what you were touching upon. So it's seen almost as a low risk to do this because it's almost victimless. So you're not going to be held accountable for it. And I think by releasing this data to the parents, you're really putting the information in the people that will probably enforce this on their children the most. So because children aren't, like I said, really caught by the police, really the enforcement comes down to the parents. And because not all, but some of the parents are complacent and they let their kids kind of get away with this and turn a blind eye, I think we've taken a step forward in at least addressing this and releasing the data to let the parents know that this is a bigger issue than they might have thought, and thereby stepping up the enforcement, if that makes sense.
Yeah, I mean, I think.
If I may.
No, go ahead, Andrew.
So I've been keeping my powder dry here for a while, probably because a lot of these data are not a shock to me, because this is sort of my wheelhouse as a college professor, as someone who has taught high school students. This is not as much of a shock as it might be to some people. And I think that's an important message, is that, as Ken said, the factors and the trends that are happening nationally and on the state level are happening right here too. And of course, the data gives us a more nuanced perspective on that. Also, there have been some comments on the survey itself, and it's actually part of a series of surveys. I used to work at the Institute for Social Research at University of Michigan, Survey Research Center, fairly well known. And this survey was adapted from a survey that's been done there for decades called Monitoring the Future. And so the validity and reliability of the data is actually very high. So this is a very useful tool, I think, and a very believable and a very reliable tool, I think, for us to have some data points to work with. Final point, just because I know we're short on time and I might not have another chance to chime in, which is fine, but I think it's important, Sarah, I think you made the point earlier, do we have support staff that are helping teachers do the work that we have been talking about, social emotional learning, integrating those modules or those ideas into the curriculum? Do we have the support staff? You know, we talked about it in the planning meeting. You brought up the points. Maybe you can elaborate, but do we have the counseling staff, the support staff, and is that something that we need to be looking at? So those are just some thoughts. Thanks.
Yeah, I was just going to ask, and I think it's something that needs to be done mindfully, and we need to think about how effective it's going to be. But, you know, as part of changing the start time in this district, we did a lot of education for parents. We brought in a lot of educators, you know, outside experts on sleep and on mental health. And I went to a couple of them. They were pretty well attended. And I wonder if, as part of continuing that focus on the health of our students, it's worth making sure I mean, I knew this was here because I'm on the board. I think some other parents who are pretty good about following board agendas knew the information was coming out at this meeting, but didn't necessarily see it in advance. I don't think most parents in this district go looking for this kind of data and are going to be aware of it. And I wonder, you know, what our role is in educating parents and saying, look, we're not saying it's your kid who's one of that 5.9% using powdered cocaine, but perhaps it's something you should be watching for. And when you see powder on the floor, don't, you know, I mean, that's exaggeration, but I think, you know, I wonder what our role is. We do regular educational programs for parents about health, and maybe bringing this data in would help spark some community conversations about, you know, not just assuming there's no alcohol at that party your kid's going to this weekend.
Well, I actually think Asa hit the nail on the head, because in the past, the issue was really the parents condoning this. I mean, I hope this stuff has gone away, but parents used to actually host parties, you know. It's like, nod, nod, wink, wink, you know, the keg's in the basement. So I think the problem is much broader, really, than the school, you know, but we have to still do our best to try to educate the community. And Andrew jogged my memory, because I made this statement in our planning meeting, but I didn't say it now. So the PSEA recommends one social worker for every 250 students in a district, and also one counselor for every 250 students in a district, and one psychologist for every 500 students. And I don't know any district that meets that, and I think Radnor's way ahead of most districts. But just to put that out there, that, you know, if we want to take this stuff seriously, there is this support out there, but the truth is that we have to put our money where our mouth is. And we're always debating where we should put our money. And right now we have an issue coming up. We have people that want us to put money into facilities for good reasons. It's always this, you know, sort of tension about where the priority is. So we kind of really need to keep spreading the word that this is a problem where we need to put resources. Every bit as important as, you know, or way more important than some of the other thing. That's my speech.
And we need to also, you know, look at what we currently are doing as well. You know, I would venture to say, without knowing the statistics, but that, you know, we as a district were very forward-thinking 10 years ago and contracting with the Caron Foundation to have somebody from the Caron Foundation on staff every day. You know, that's not something I have seen, and I see at every district. I know there's other districts in the area that do that. I mean, some beyond our Delaware County area, but as I talk to other superintendents and my experience in 2 other districts, that's not something you see. So there are a lot of things that we have done as a district, continue to do, but we will be talking about at the budget discussion later tonight, some opportunities also where we see where we could be adding some mental health support as well to the district as we move forward. And the challenge with this conversation, we do this as a group, and I knew this would happen too with the board, is we want to quickly solve everything. And we need to make sure we're taking our time. That's why it's purposeful that this was findings tonight, recommendations in the fall, that we're also purposeful in looking at what is it we're currently doing, what's working well, what isn't working, and develop those recommendations that are going to have an impact and make a difference. So we will be coming, having more discussions about what can we do and what are the recommendations as well as we look to the fall.
I just have one follow-up concern with the lifetime experience of having alcohol as a 12th grader doesn't concern me as much as 22.4% reporting coming to school drunk or high. That's a major concern that I have. And binge drinking is another major concern. But to get back to the discipline and the in-servicing and making sure that our teaching staff, not only our teaching staff, but our entire staff realize and can see someone who is impaired and that we take official action on that. So it would be very interesting to compare the 22% that self-identified coming to school inebriated and see what our actual statistic is. What did we find? Did we find any? I don't know. But there's a self-reporting, and then there's what are we doing? Just like you say, it's not something that really has a big risk, and I don't like that. I think that you should understand if you come to school inebriated, there's a consequence for that. So that's something that troubles me more than the other piece. That really does trouble me.
Going back and matching all of that data, I think, is an important piece to do. I can tell you from someone who, and I'll speak for Dr. McQuigg and as well Maureen, we see, these reports and when those happen, that, we do catch students and they are held accountable. And our teachers and, I believe our teachers and even our support staff, right down to the person greeting the kids as they come in the morning, are very good at looking at what's going on with their kids when they notice something different, sending them to the nurse, having them looked at and evaluated. So there isn't a turning a blind eye, but I agree, we got to dig deeper and understand how is this happening and when's it happening.
Well, I'm not accusing anybody, and I never do, but what I'm saying is that really troubles me. The other statistics do not, because as my esteemed colleague here said, I was a teacher in prison for 12 years, actually 14 years. So these don't disturb me, but what disturbs me is when you're coming to school that way, or if you're binge drinking, you have the issues of drunken driving, of judgment. Your judgment isn't keen, and it can really disrupt your entire life. And we're here for the whole child. So that's something that I just agree with that we need to look at, that's all.
That goes the lines of responsible decision-making, ethical, and that's actually a national survey. Parents believe that that's most important. So I think that's well taken.
Anna? Stopping point.
Yeah, just as far as next steps, in June, we'll finish up the presentation with the second and the third components of the study. But we did have some opportunities for parents to offer some input scheduled between now and then on May 23rd in the evening, 6:30 to 7:30 in the LGI next door, and May 28th during the day, 9 to 10 here. Really, it would be an opportunity for parents to share some input to help our thinking as far as what do they see as the priorities and with the items that we've presented, as well as the ones we didn't yet, and also anything they might want to contribute towards recommendations. So there's the chance for parents to offer input that way. There's also an email address, wellness@rtsd.org, if people would like to email us with any input that they would care to share.
Okay.
Great.
I want to thank all of you and our two guests for this presentation. yeah, this, for me, this is what it's all about. So I'm really happy to start this conversation, although it's kind of mixed news, but the good part is that we're going to do something about it.
Well, when will we get to the physical wellness?
So parts 2 and 3.
Want to leave that go?
Oh, you weren't here when we started.
So we made an agreement at the beginning that we would stop at 10 of 6 and wrap up, and then we'll need to talk about our meeting for next month. So we'll have 2 sections of the wellness study to cover, and then we're also going to be hearing from our librarians, K-12, and also our English learner teachers from K-12 reports on their annual audit. So we'll have to talk about whether or not an hour and a half or 2 hours will be needed next month.
Right, and we also have, you know how we always do the book adoptions? They're going to be on display. Oh, were you? Okay. That brings us to any new business. Anyone have anything? And our last round of public comment.
I would just like to commend Mr. Madden for remembering our commitment to the NAACP in regard to discipline. I think that's very important as we move forward. And secondly, I would hope that every member of the board right now remembers that we did have a hiatus when we were not given this information, and the importance of having this kind of information every 2 years as an important database as we look at our students through the future. Thank you.
Yeah, thank you, Roberta. Is there any other public comment? Okay, and again, I want to thank the people that are going to have to come back next month to finish the presentation. We really appreciate your willingness to work with us in our schedule. Okay, and with that, we will meet again in June, the second Tuesday at 5 o'clock. Am I wrong? Third Tuesday. I'm probably off.